Welcome, everyone. I'm Emily Bertrand, Director of our Mid-Market Business here at Xero. Thanks for joining today for our first of our 5-part Fireside Chat series, where we're going to be focusing on the challenges, pain points, and emerging cybersecurity solutions available to healthcare organizations across the U.S. To kick things off today, we wanted to touch on the biggest asset and also the biggest liability to those businesses, patient info. Stolen health records are selling up to 10 times more than stolen credit card numbers on the dark web. And I'm sure, as you all know, it doesn't stop there. The cost to remediate a breach in healthcare is almost 3 times that of other industries, averaging $408 per stolen healthcare record versus $150 per stolen non-health record. So one would think that those numbers speak for themselves. And while 90% of hospital administrators consider the security of data a top focus, less than 40% actually feel adequately trained or prepared to actually mitigate the cyber risks that could impact their organization. Before I introduce you to our speaker, some quick housekeeping for those audience members joining us live today. If you have any questions, please submit them. If we don't cover it in the chat today, we will follow up with you afterwards. At the end, you can also rate us. We want to make sure we continue to deliver talks that are valuable to you. With that, we wanted to bring on an expert to provide more insight around how healthcare organizations should be thinking about protecting patient data. Joining me today is Adam Mansour, the Chief Security Officer here at Xero. Welcome, Adam.
Thanks, Emily.
So let's jump in. First, what are hackers using patient data for? Let's start with the basics.
Yeah, I think that obviously they're using it for financial gain, right? There's been a massive uprising in the attacks against healthcare organizations, specifically about over half of since 2019 attacks that are leaking patient healthcare information are really about hacking, right? About taking down networks, breaking into systems, and the exposure of those healthcare records between. So when healthcare records are exposed, about half the time when they're hacking in and deploying things like ransomware, they're not even necessarily using the information other than extorting the healthcare organization itself, right? A lot of people that talk about the loss of those records and the fact that there's fraud you can commit after the fact when those records are missing, tend to focus on the fact that unlike a credit card, which you can simply reissue, a lot of those things don't change. A lot of that information that you're getting, everything from address information, social security information, other types of identifiers, they're not things that very easily change for the user. And so they lead to certainly other kinds of fraud. That's what they're doing with some of the information, but mostly what they're targeting the organizations with is ransomware exploits, is an ability to extort them for Bitcoin. So the only thing they're using that information for isn't just to extort Bitcoin out of you, but that's the lion's share of the practice.
Can you walk us through how are they typically getting it?
Mostly when you think about your users and the way that your IT staff or systems admins or others will log into a lot of the programs and systems that you build, they are using credentials, right? They're using usernames and passwords. And by and large, when you hear about these large-scale breaches from things like LinkedIn or Evite or House or one of these services that a lot of people use, typically they're bringing their corporate IDs to those systems, right? Either for password resets or because it's easier to enter one account to these places. And of course, they're entering likely the same password in some cases because they have to remember it as the ones that access the corporate system. So one of the major ways that these attacks are being perpetrated is through trading of credentials that have been leaked through other sources like LinkedIn, breaches that leave those passwords exposed, and then bringing those to sales sites like the dark web or instant messaging and things between hacking groups. And then once they get those credentials, they typically will go under the radar of a lot of the security product that most healthcare organizations have purchased, right? Most of them buying what they think are best of breed and probably true, products at their edge for their network or on their endpoints, right? A big focus for IT security in those organizations. But then, a legitimate credential is just going to kind of go through all of that, right? And so once the attacker kind of, identifies the places where you have sensitive systems or data, something you can't sort of live without, right? Like, you operate with key systems to keep your network up or your systems from, logging in and all these other things. Those are the systems that they're going to try to attack, right? The file system, your EHR apps, those kinds of things. So So that's really what happens. And then the last step here, when it's time to extort, they either take the data, right? They copy the data with those credentials that they have or their exploits. And then they sort of start the extortion campaign, right? They start communicating with you for Bitcoin, calling you, leaving you notes, and then at the same time deploying encrypting technology, ransomware, to tell you, hey, if you want your systems back, you pay, and even if you don't want your systems back, we're gonna start telling people that we have your data, or we're not going to give you your data back, and you're not going to be able to go back to work. So that's usually the same sort of pattern that we see for a lot of these exposures, and now 62% rise in this type of activity since 2019. So really during the the pandemic, at least, we're really seeing a rise in this type of activity, sort of a normalization of how it's happening, right? Less about people accidentally leaving something out or losing a tape drive or sending the wrong information to the call center to the wrong person, that kind of stuff. So less accidental leakage, less exploits focused on logic and things like that. Just typical exploit techniques, hacking techniques to get this stuff.
I want to get back to the technology side of things and stuff around protection a little bit later on. But let's say you think your data might be missing. What steps do you have to take at that point before you've actually been able to validate this and it's just a feeling?
Yeah, I think certainly it depends who has this feeling, right? Obviously, you want to make sure that you have tested your incident response, that you completely understand the communications avenues, that you're communicating very clearly. You're not, overreacting. You're able to make, sound justifications for why you believe that the data may have gone missing or has been accessed. A lot of people either, under or overestimate whether or not they actually have, their data lost by just a login that they see from a suspicious place, or, some sort of a tampering of a system, right? A lot of them not being able to confirm whether or not they ever actually had, a data loss event. Some of them just see, things like ransomware or another cyber attack, and they don't have the monitoring tools. They don't have the background to sort of dig in and say, okay, we suspect, and this is how we confirm that information obviously went out, right? And so there's a lot of things that you could do from a technical perspective to monitor for that, but the best process that you can implement is to actually run through these exercises and try to answer the questions, right? And knowing when to stop the exercise and start to notify third parties, right? A lot of people will sort of spend time in their incident response kind of communicating internally. They'll hide a lot of that, ugly, third party communication to obviously privacy offices and places like their stakeholders, right? Because they don't want to obviously embarrass themselves. They don't want to end up on, a potentially liable, like a liability position where they're, potentially going to get sued or have to pay fines. And so you don't want to have this, not practiced, right? I think if you suspect that something's the case, there's a run book for that kind of thing. And there's help and experts that have to make that qualification. If you yourself are a non-technical person, or if you're a technical person without experience doing these types of forensic investigations, it's very hard for you to make that statement, right? So you're gonna have to say, well, this is what I suspect is happening, and let's go through and make sure that we can get expert advice, or at some point go through the channels to get this type of stuff properly adjudicated, because otherwise you're guessing, right? And if you guess, you may be opening yourself up inadvertently to liability. And if you guess wrong, right, you may also be, causing the same thing, right? So try not to guess.
A lot of things you've said have had to do with people, process, and tech. I know we talk about that a lot here at Act Zero. For the folks on the line, if they're to take an objective look at their current people, process, and tech when it comes to this, what pointers would you give them in assessing what's working, what's missing, how they can better prepare for this eventually happening?
Yeah, I think scenarios are always going to involve those three capabilities, right? Like if you take a scenario, for example, of you have a backup that was put on a USB key and you lose it, right? That's one scenario. If you say that a hacker has complete control and has encrypted our EHR app, our database, right? Our security has failed us, and we're at this position, right? What's the process, right? Now that we know that those scenarios are likely, not just two, right? There's many others. But if you take those two basic ones and say, okay, well, how do we actually communicate? How do we discover? Who discovers? Who do they go to? What are the channels that we need to communicate? How do we do a forensic investigation? How do we, notify correctly? All of those things are just part of testing incident response. We call it tabletop exercise. We have guides you can download for free that will walk you through a couple of these different scenarios, link you to the privacy offices, the places where you have to disclose this type of information so you can practice. Because a lot of the expectations from people are that they're going to create a policy and that policy is going to be something that they will follow in an emergency, right? Where time does matter, right? Notification, you have a time limit, right? Certainly under a cyber attack, you want to contain the threat as quickly as possible. And you have a very short window, of course, to maintain operations. You got to communicate what's going on with other stakeholders. What if we lose that app? Do we stop, taking in patients electronically? Do we have to start rerouting people to different areas? Do we have, a paper method that will take over if the tech fails, right? So a lot of this continuity planning, I think, is something that most practitioners have probably already gone through. Everything from, losing power to natural disaster, they've all been part of the practice of business continuity. But, we just have to prepare for these newer scenarios that are very acute, right? They're very focused on disrupting a very specific part of your business. How do you react? How do you notify when that kind of thing happens? So it's practicing incident response, it's making up those scenarios and walking through them and measuring your time, right? Seeing how fast you can go through it. That makes you prepared for this type of thing. If you don't know what your time is to react to those things right now and you're listening to this, you haven't done it. If you say I have an incident response plan, but you don't know how much time it takes you to notify of a ransomware incident that occurs right now, if the clock was running, then you should retool to test against that and measure that.
Say they have gone through that and they think they can be faster. How do they get faster? What would one takeaway for them to, shorten that speed to a resolution or uncovering what's actually happening?
Yeah, I think that obviously a lot of time spent investigating, that wastes a lot of time. Certainly, communication, try to limit the amount of, communication points that you have to take. Right, a lot of people will set up very complex structures with teams that have to notify several individuals, and when they're collecting information, they're collecting them between 2, 3, 4 parties. Right, that really slows things down. And so, making sure that you're quick is good. You also have to make sure you can maintain. Like if you think you're quick, I'd say more than trying to shorten your time, try to do it by changing a major element of the plan. Right, take your key person, the person who really knows how to do these kind of notifications, out of the game because it's the weekend or the middle of the night. And test if you have similar times there. You need a good average to really say that you're actually meeting that time instead of going through the same routine over and over again and being like, let me cut it out. But then once you have a few scenarios that can affect it and you have a good average time, again, cutting down communications points, limiting the amount of time in between communications, right? Making sure that you're not spending too much time on investigation, right? A lot of people will say, well, we need to identify a root cause, right? A root cause is something that happens, weeks maybe after the incident, right? That's not part of the time. So trying to find the actual, root cause, how they got in or something like that, that's not a very valuable thing to try to include. So there are some things where you can think about it, try to stick to a time limit of 15 minutes, right? Never go beyond that because that's what you want to try to sort of set up in a procedure. No procedure should take longer than that when it's, considered beginning, middle, and end of the incident response. But limiting communication and definitely making sure that you try to move stakeholders in and out of that position to see if you can maintain that time are very important because that's how it happens in the real world.
Yeah, interesting. Well, it appears we've quickly run out of time again. We're just over 15 minutes here. Thanks, Adam, for taking some time out of your schedule to join me today. No doubt our audience gained some considerable insight into protecting patient data. And if you're looking for more information, please feel free to visit our website at ax0.ai and check out our resource library. And thanks to everyone who's joined us today. If you do have any additional questions, please reach out at info@ax0.ai and someone from the team will get back to you shortly. Look forward to seeing you again soon.